Hi, my name is Kim, and I'm going to be giving you an overview of Alzheimer's disease. What is Alzheimer's disease? It is a brain disorder that is progressive, chronic, and degenerative. There is no cure for this disease or a way to slow down its progression. It is also the most common form of dementia. Alzheimer's is fatal, so death is imminent around 4 to 8 years after being diagnosed, and some can live up to 20 years. There are pharmacological and non-pharmacological treatments to temporarily relieve the symptoms, and I'm going to shed some light on the stress that a caregiver can go through when dealing with a loved one with Alzheimer's disease. So, a little on the background is that this disease causes an eventual loss of certain brain functions. These include memory loss, loss of perception to time and place, language skills, and eventually an inability to take care of oneself. The only way to confirm this disease is through a brain autopsy, where in the brain you'll find plaques and tangles. Age is a risk factor, a major risk factor, when it comes to getting Alzheimer's disease, although there are other risk factors that could be involved. These include diabetes mellitus, hypertension, trauma, obesity, and smoking. When taking care of this patient, it's very important to know that there is no cure for this disease and there's no way to reverse the progression. But there are temporary ways to relieve the symptoms, which includes medications such as cholinesterase inhibitors, which relieves the decretion of memory and cognition, and memantine, which protects the nerve cells from degeneration. When a patient is usually diagnosed with this disease, be prepared for assessing with them for depression, especially when referring them to counseling or providing them with antidepressants if needed. It is vitally important to start talking to a caregiver and educating them on interventions, especially when the disease starts to progress. Make sure that when a patient is feeling anger, confusion, or any behavioral issues, to redirect, distract, and reassure the patient. You should also educate the caregiver on these interventions. Other interventions that the caregiver should know about are behavioral and safety. That includes providing a quiet, calm environment for the patient, exposing them to daylight, driving them around, going on frequent walks, limiting naps and caffeine so they're not agitated at night, and safety precautions such as keeping things in the same place, removing clutter and excess furniture, and keeping stairs well lit. There are other interventions involved, which include pain management, oral care, eating habits, all of those. Research shows that there's also an increased amount of caregiver burnout, so intervention should be used also to prevent that, such as effective coping skills. So recommendations, they would recommend a well-balanced diet, of course, with lots of fiber and vegetables, avoiding alcohol and smoking, especially smoking, since that doubles the chances of you getting Alzheimer's disease, and considering the stress of the caregiver, which includes frequent walks, referring them to support groups, and maximizing sunlight in their life. So in conclusion, there's no cure for Alzheimer's disease, but there are drugs to temporarily relieve symptoms. Consistently educate the caregiver on interventions, especially as the disease progresses. Interventions will change. And to remember that as a patient's disease progresses, there's a higher chance of a caregiver burnout, so consider them as well. Thank you, and I hope you take something out of my presentation.